Okay, now we will turn to community engagement, and we have our next speaker, Mr. Nuttawut Teachatanawat from the Clean Air Fund, who will share a case study on community-led air quality and health monitoring and air quality data governance under the Breathe Bangkok Initiative. Mr. Nuttawut is a seasoned human rights lawyer and development practitioner with over 16 years of experience across Asia, currently serving as the Breathe Cities Lead, Thailand, at the Clean Air Fund, where he oversees the Breathe Bangkok strategy and innovative community-led air quality and health monitoring initiatives, backed by advanced training in administrative, environmental, and international law. So please welcome Mr. Nuttawut.
สวัสดีครับ It is with my immense and great pleasure to discuss about our project that we conduct in partnership with Urban Research Institute Foundation, who share the same passion on community engagement, tackling air pollution from environmental governance and also environmental justice perspective. This project has been conducted in partnership with BMA, and there have been, when we talk about the next generations of air quality monitoring, and very happy that our project will try to pioneer and provide some innovative approach, particularly working to community-based less model that we'll discuss. But before that, before starting our project, we conduct a comprehensive and gap analysis of city of Bangkok and what we need to tackle to address the key pain point or structural barrier that impact BMA in terms of conducting a more inclusive clean air management. This is what we found, and this is what we plan to address in our humble project. The first one, I think in the beginning session, we discussed about the lack of localized, integrated, inclusive air quality data. As you know, that oftentimes air quality, climate, health data are collected, analyzed, and used by different agencies and not have been systematically used and translated into a more integrated approach. And that is one of the tackle challenges that we aim to challenge on how to make that data more integrated and used at the Bangkok centralized level and also at the district level. At the same time, we also need air quality and health monitoring tool that can translate into health-focused interventions, and particularly for air quality health index that could be used as communication tool, so that city could have a more health risk mitigation strategy and also health protection measure for, especially for those who are disproportionately affected by air pollution. We also need a quality action plan that at a district level, as we know that one size fits all policy might not be applicable. If you see Bangkok, we have 15 districts with different zones, and different zones are affected by different sort of air pollution, different situation, particularly in terms of the vulnerability of the community. So we need a more contextualized local-led bottom-up process in terms of air quality management, backed up by the data and research that the project will provide. And lastly, financial and budgetary constraints play an important role in implementing Bangkok capacity. Right now, as you might be familiar, only 0.2% of the budget had been allocated on air pollution, and that signal a stronger need for addressing from the budgetary constraint. So here is our innovation and what we try to achieve in the next years. In terms of community-led air quality modeling and health monitoring models, currently we are piloting air quality and health monitoring in 15 pilot districts. And these districts are the ones that are overburdened by air pollution and also with the density of the vulnerable groups. And in our case, this is informal workers, the elderly, children, women. At the same time, this year will roll out community outreach program to support air quality and health literacy project to help volunteer build on the embed network that have been working from the COVID-19. And that will kind of scaling up the community-led model to tackling the sustainable finance of the community-led initiative. We provide training and empowerment tool on participatory budgeting so that sustainable financing model for community-led model will be developed. For integrating air quality data governance with support from BMA, we are able to establish the Air Quality Data Governance Committee to facilitate the development of integrated air quality data system and capacity strengthening on air quality data systems. And the last two innovation, Air Quality Health Index, will be developed in partnership with BMA, and that will be to pilot the Air Quality Health Index along with the Air Quality Dashboard that will be pilot to the work with community. And lastly, we will provide technical support for the development of the district level air quality action plan, conduct in to the survey of the baseline assessment, evaluation of the impact of the effectiveness of clean air initiative that Bangkok have done, and to provide policy development and technical support for policy adoption for Bangkok. So I think my time is up. If there are, but I have some about the recommendation. In summary, I think the community play a very crucial role. And when we talk about the next generations of air quality monitoring is irreversible and will be prerequisites for us to work with the community, particularly looking from the human right perspective. I'm talking about the access right, the right to information, the right to participate in decision making on a matter, and also the right to access justice, and that should be at the cornerstone when we talk about the next generation of air quality monitoring tool. Thank you.